to Santa Clara County Library District to read statements, photographs, audio, or video footage of you for purposes of library, educational, promotional materials, publications, or other purposes, as determined by Santa Clara County Library District. You waive any rights of compensation or ownership to the recordings. Now I'd like to thank Stephen and turn the event over to him.
Hi, well, good morning, everybody, and thank you, Lisa, for having us and partnering with us this morning to educate our community about some important topics about Medicare's annual enrollment period that we're currently in right now, and we're also going to educate you on some of the changes coming about for 2021. And my name's Stephen Rubalcaba, and I work with the Health Insurance Counseling and Advocacy Program, which is commonly referred to as HICAP across the state of California. And the organization that we're housed under is a nonprofit organization, been around since 1973, called Sourcewise now. And I would also like to let folks know, if you can or want to, some features within this Zoom environment. I know it's fairly new to a lot of us. If you look down, at least on the bottom of my screen, there's a chat feature. There's also some reaction features here that I just shared. When I introduce Abe, he's going to be our presenter for the day. He's one of our state certified HICAP counselor educators that is going to inform us about some of these Medicare topics. But the goal is for when Abe begins the presentation to kind of move on through uninterrupted. And then at the very end, we're going to have an open question and answer forum. But I'd still encourage you to utilize that chat feature if you have a question throughout the presentation. Maybe you're afraid you're going to forget it. If you just need some clarification, please feel free to use that chat little box. I'll be answering and fielding questions in the background while Abe's educating us. And if we can also just maybe keep our microphones muted just to avoid any type of interruptions or any distractions. I know me, I have geese squawking in the background, so I'll definitely have mine on mute. But again, I would like to thank everybody for joining us here today, this morning, and letting us talk about some Medicare topics. So Abe, I think it's all yours. Thank you for being here and helping us today.
Thank you, Stephen, and good morning, everyone. I hope this is something that you're going to find helpful. As Stephen said, well, as you can see on the slide, the reason for this thing is because for Medicare recipients, we're in what's known as the annual enrollment period, or some people call it an open enrollment. But the whole idea is this is a time when you can and maybe should be thinking about what kind of changes you might want to make to your Medicare coverage. And what we're going to do today is, do this again so it starts. There we go. What we're going to do today is talk about some of these things. But as Steve mentioned, the organization Sourcewise that we're involved with functions as the area agency on aging with a variety of services targeting seniors. And the one that I'm involved with is the Health Insurance Counseling and Advocacy Program. And as Stephen mentioned, we refer to it by the acronym HICAP. And so if you hear me saying HICAP during the presentation, it's a short version of the name. It's part of a national network. It's a federally funded program that does not take any money from the insurance industry and does not sell insurance. As I said, it's federally funded. And nationally, it's known in most of the country under the acronym SHIP, which stands for State Health Insurance Assistance Programs. And there are versions of it in every state, but in California, we call it the Health Insurance Counseling Advocacy Program, or HICAP. And before the pandemic, we had counselors at various libraries and senior centers and health facilities around the county. I think I've counseled at the Cupertino Library at least once. And so these days, we're doing all of this by telephone and video appointments, but you can make an appointment to talk to one of our HICAP counselors. The number you see on your screen is going to come up several times, and it's in the handouts that you have. But I will be, during the presentation, encouraging you to think about making appointments to talk to our counselors. And this is the annual enrollment period. It runs from October 15 to December 7 every year. And during that time, if you're with Medicare, you can use this to change your prescription drug plan to one that might save you money. Change your Medicare Advantage plan if you're in that from one plan to another, or go from traditional Medicare to Medicare Advantage, or go from Medicare Advantage back to traditional Medicare. And I'll talk about some of the things that you need to keep in mind if that's something that you want to do. But whatever changes you have to make by December 7, and then they become effective on January 1. And what should trigger it is that you should have received an annual notice of change from your drug plan or from your Medicare Advantage plan. They're required to send those out in September. And they'll show a side-by-side comparison of what's going to be different in the following calendar year. So the drug plans will send you something that says maybe that your premiums are going up, or that your deductible is changing. The Medicare Advantage plans will send out something that might say that they're increasing the premium, or that they're changing some of the facilities that they contract with, or that they're changing some of the additional services that they provide. This is important information because it should trigger you to look at those changes and think about how they might affect you. So part of what I'm going to do, the years I've been counseling, I find that even people who are knowledgeable about Medicare frequently benefit from a quick review of the parts of Medicare and how they work. So I'm going to go over that briefly, and I'm going to talk about the four main parts of Medicare. Part A, which is hospital insurance. Part B, which is medical insurance. Part C, the Medicare Advantage plans. And Part D, which is the prescription drug coverage. So traditional Medicare originated as a fee for service, the way we've kind of in this country always done things. Someone performs a service for you, they get paid. And, you know, the old way of providing medicine, you went to the doctor's office and the doctor gave you a bill and you paid the bill. And if the doctor didn't do anything, you didn't get charged. And so they set it up originally as a fee for service. And Part A deals with inpatient hospital primarily and things that are related to that. So it includes coverage for some skilled nursing care under certain circumstances after a hospital discharge, or home health care under certain circumstances, or hospice care, which is defined as for someone who is expected to live only 6 months or less, and they can opt for that. And Part A, most people don't pay for it. It's covered by payroll deductions that you made during your working career. But Part A, while it's free in that sense, also includes copays and deductibles. So there are deductibles and copays for hospital stays, for example. Part B is the part that covers outpatient kinds of services. When you go to the doctor's office because something's bothering you, or the doctor orders labs of some kind, x-rays, blood work, etc. It also covers certain physical therapy, maybe after you've had a certain treatment. It covers medical supplies, such as orthotics or canes or walkers. It does not cover what we think of as the old-fashioned annual physical, but it does cover something that they added under Obamacare called the annual wellness exhibit. And it does cover certain preventive services such as flu shots. Now, here's the thing about Part B. Part B only pays 80% of the agreed contract rate with the doctor's office or the facility. And you, as the patient, are responsible for that other 20%. So an example might be if the doctor sends you for labs, and the lab would charge, let's just pull a number out of the air. If the lab would say for someone walking in off the street, their bill would be $1,000. The lab can bill Medicare $1,000, but Medicare might have a contract with them that says, well, you bill whatever you want, but our agreed on contract rate is $500. And so Medicare says that's all the reimbursement you're entitled to. But Medicare doesn't pay the $500, they pay 80% of that, or $400, and you as a patient are responsible for that other 20%, that copay. So because of that, a whole insurance business arose to sell what they call Medigap or Medicare supplement insurance. And those are insurance companies that are sold by, insurance plans that are sold by private companies that are designed to pay for some or a portion, so all or a portion of those gaps that and copays. And we'll go into a little more detail in a few minutes on how you evaluate those and what they are. Then in 2006, Congress finally put into effect a prescription drug coverage for Medicare because for the most part, prescription drugs weren't covered. And that was a big burden on people receiving Medicare. And this is a time of year when you should be looking at your prescription drug coverage, and you may be able to make changes that save you money. So then, as a political thing, Congress wanted to try to privatize the program, take the burden off of the federal government and put the burden on private insurance companies. So they created Part C and gave it the name of Medicare Advantage. Now, Advantage is a marketing name. Whether it's an advantage for you depends on your circumstances. It is for some people, it's not for others. But unlike the fee-for-service of traditional Medicare, this is a capitated program. The fees that these insurance companies are based on, they're a per capita and they're limited. So the way this works, well, first of all, we have here in Santa Clara County, we have 55 of these plans, these Medicare Advantage plans. Last year, there were only 43, so we've had an increase in them. But the way it works is that the government takes money allocated under Part A and the Part B premium that everybody pays, and they combine that with an administrative fee, and they send that over to these insurance companies. And the amount that they get, I haven't seen for 2021, but for 2020, it was here in Santa Clara County, it averaged a little over $1,100 per month. That's $1,100 per month per person, per capita, regardless of whether they see that patient once a year or once a week. The reimbursement that the Advantage plans get from the federal government does not change. So they have to manage their services, and they set it up as what they call managed care. And most of them here are the HMO model. And the best known version of the HMO model here is Kaiser Permanente. But under the HMO model and under managed care, you're required to see their network of physicians, use their network of facilities, their network of labs. And in order to manage care, the primary care physician becomes, in effect, the gatekeeper who says whether it's okay for you to see a specialist or not, or what kind of treatment you get next. Whereas under traditional Medicare, you can see any doctor anywhere in the country. You don't need your primary care physician's approval. You don't have to worry about networks. But in managed care, the HMO model, if you want to see a specialist who's not in their network, or you want to see a specialist and they've said no, and then you go out of network, you have to pay for it. And you may not have coverage when you travel to other cities except under certain emergencies. So it's network versus see whoever you want is one of the big differences. But another big difference that provides an advantage to some people is that all but one of the Medicare Advantage plans here have prescription drug coverage. And so you don't have to find separate plans. You get it all rolled up into one package. And we're going to talk a little more detail about these in just a few minutes. Now, everyone pays the Medicare Part B premium. And in 2021, that's increasing, and it'll be $148.50 per person per month. You have to pay that for Part B coverage. Then here in Santa Clara County, we also have a lot of high earners. And so what happens is that for a couple filing a joint return with a modified adjusted gross income of greater than $176,000, there is an additional what they call income-related monthly adjustment amount that is charged to you on top of your Part B premium. And depending on your earning level, that can be anywhere from another $59 a month up to $356 a month, in addition to your $148.50 Medicare Part B premium. But this confuses some people in terms of the way it works. It's a 2-year look back. So the amount that you would pay in 2021, it's based on income in 2019. Now, here's the way that works. Let's say, for example, in 2019, you sold an investment property and you had a one-time gain. Well, you would have reported that on the tax return for that year that you filed this past April in 2020. By the time that works its way through the system, through the computers, gets reported to Medicare, it shows up as that adjustment amount in 2021. And that's readjusted every year depending on your modified adjusted gross income as based on your tax return. Now, even though, while on the one hand, there are the extra payments that high earners pay, for people who are low income, there are various kinds of assistance in paying these various kinds of premiums. And rather than go into all of that right now, if you think that might apply to you or someone that you care for, who's a low income person, make an appointment to talk to one of our HICAP counselors, because we can help you figure out what kind of resources might be available to you in order to get help with these premiums. So I mentioned earlier that there are these insurance policies, the Medigap or Medicare supplement, that are designed to help you with the copays. And what they are insurance policies rather, that are sold by private companies. Depending on certain circumstances, they might be able to use health screening. And they set it up as 10 standardized plans. Standardized in the sense that they have to follow certain rules and provide certain levels of coverage. Now, here's one of the things that confuses people. I was just talking about Medicare Part A, B, C, and D. Well, how did they name these plans? They named these plans A, B, C, D, etc. They could have named them something else. Don't let this confuse you. A Medigap Plan A designation has nothing to do with Medicare Part A. It's just they gave them the same names. And so to get a Medigap plan, you have to have both A and B, but you cannot be in a Medicare Advantage plan. So this is the way to interpret these. You've got a handout that should have been emailed to you by the library system. Excuse me, take a sip of water here. You got, they emailed something to you that among the emails is something that explains the various Medigap plans. And if you look at the first page of it, and don't do it now, you can do it later, you'll see a matrix. On the left-hand side where it says benefits for 2021, it lists the various kinds of Medicare kinds of coverages and the copays and deductibles that come along with those. So you see, for example, the hospital insurance or blood or Medicare Part A deductible, Part B deductible, foreign travel emergencies. And so if you look under Plan A, you look across under those plans designated Plan A, you see it has a dot in 4 of the squares. If there's a dot in the square, it means that plan covers it. If there's not a dot, that plan doesn't cover it. So you see the Plan B has dots in 5 squares. And as you go along, you have different levels of coverage in each of those areas. There's only one plan that has a dot in every single square. And that's the Plan F. But Congress basically eliminated that Plan F for anyone who became did not already have it or was not eligible before 2020. So people can only have Plan F if they were Medicare eligible before 2020, and those people who have Plan F already got grandfathered in. But for anyone becoming Medicare eligible after January 2020, they have to have something where at least the best plan available to them now is the Plan C, which does not cover the Plan G rather, which does not cover the Medicare Part B deductible. In that handout, after this front page, there's an alphabetical listing of all of the companies that offer Medigap Medicare supplement coverage here. And you can look at that and see what their rates are for you and your age and the kind of coverage that best suits your needs. Now, here's the thing. These vary by age and zip code. I mean, the premiums, and the premiums are all over the place. Now, you should know every Plan A, they're standardized, has the same coverage. Let me go back to this. Every Plan A has the same exact coverage as any other Plan A. Any Plan B, the same as any other Plan B, all the way through any Plan F, the same coverage as any Plan F. The only difference is the name of the insurance company that sells it and what they charge as a monthly premium. And so, for example, with the Plan F, which provides the best coverage, the most expensive company here charges about $100 a month more than the least expensive company here in this market. And so what I tell Medicare clients is that if the coverage is the same, why pay more? Go with the insurance company whose plan has the lowest premium for the coverage that you need. Now, they do vary, as I started to say, by zip code and by age. So what the prices that we have here in Santa Clara County are going to be different than they are in other parts of the country. I have a younger brother who's 3 years younger than I am. He and I have the same Plan F from the same insurance company. He lives just outside of Philadelphia, and his monthly premium for that same insurance company's Plan F is about $20 more than mine is. It's because of where he lives and the way they rate the populations. The handout that we have has the best information that we had at the time it was created for what those premiums are going to be, but reconfirm it if you're looking at something like that or thinking of changing. You can go to insurance.ca.gov to get the rates, or in any event, contact the plan directly and ask for a quote for what your premium would be under your circumstances for where you live. And we have all that contact information in that handout. So now let's talk about prescription drug plans, Part D for drugs. And as I mentioned, that didn't come into effect until 2006. And again, you should have received an annual notice of change from your prescription drug company. And typically they'd say, hey, we hope you like us. We hope you'll stay with us. And starting January 1, here's what your premium will be, and here's what your deductible will be. And they should show side by side what those changes. Now you need to pay attention to that because most of the time those premiums are going up. And that doesn't necessarily mean that you have to stay with that insurance company because sometimes changing can save you a lot of money. But if you're going to do it, you have to make these changes during the annual enrollment period. So we have 32 standalone prescription drug plans that are available to us here in Santa Clara County. And of the Medicare Advantage plans, all but one of them include prescription drug coverage. So the thing about the prescription drug coverage is that when they set it up, they did it in a really complicated way. I think it could have been a lot simpler, but here's how they set it up. And I just need to take a few minutes to explain to you how it works. Because first they set it up with what they call 4 coverage periods. Coverage period 1 is what they call the deductible period. Now, the plans around here have deductibles ranging anywhere from $0 to $450 a year. Varies by the plan. And they have an initial coverage period, then they have a coverage gap, and then they have a coverage catastrophic period. So here's the way this works. During the deductible period, most people pay 100% of the cost of the drugs until they meet the deductible. Now, some plans have 0 deductible on certain drugs even during the deductible period, and other plans will have a high copay for those same drugs during the deductible period. It varies by the plan. It's up to them individually. But typically, assume you're going to pay the full cost of the drugs while you're in the deductible period till you meet that deductible. Then you move into what they call the initial coverage period. And on an actuarial basis, Medicare recipients pay about 25% of the cost of the drug. I say on an actuarial basis because some people pay more, some people pay less, but as a whole, it averages out to about 25%. Then you stay in that until a certain point. I'm going to explain these numbers for you in just a minute. This $4,130 of true out-of-pocket costs. Once you exceed that, there used to be something called the donut hole, where there was 0 coverage, and you paid 100% of the cost of the drugs. And I don't understand why they ever set it up that way, but it was called the donut hole. You fell into this hole of 0 coverage. But that got eliminated under the Affordable Care Act, Obamacare as it's known. And so now when you hit that donut hole, you pay, or the coverage gap rather, you pay 25% of the cost of the drugs on average. Now, you stay there till you hit the true out-of-pocket cost of $65.50, but the way they calculate that is a little bit confusing. So the way that works, they take what you pay in the deductible period plus what you pay in the initial coverage period plus what you pay in the coverage gap for brand or generic drugs plus what the manufacturer pays, contributes to that during that period. And when that amount hits $6,550, then you move into what they call the catastrophic period. And in the catastrophic period, you're paying the greater of 5% of the cost of the drugs, or $3.70 or $9.20 for brand names. And then that resets every year in January, and you go through this whole process again. Now, the premiums did drop for some plans this year, and the lowest monthly premium for a plan this year is $7.20. The highest is $130.40. And their deductibles are all over the place, from $0 to $445 in 2021. And their copays are all over the place. And some plans have a very low premium and a high copay. Some have a high premium and zero copay. Some are all over in between. I'm sorry, deductibles rather, forgive me. Low premium, high deductible, high premium, low deductible. And it's the copays that go up and down and are inconsistent from plan to plan. And trying to figure this out on your own can make you crazy. That's why I'm going to tell you in a moment how to use the Medicare Drug Plan Finder. But one of the things that's relevant here is that the national average base premium is $33.06. And the reason that is something to note is that's what Medicare bases the delayed enrollment penalty on. And so there are some people, and I counseled a man like this, who I met with him. He was 84 years old. He had always been in remarkable health, and so he never signed up for a drug plan. He didn't need them. He figured, why pay that money? But now at age 84, he was starting to need a lot of expensive prescription medication, so he came in wanting help finding a drug plan. Here's the problem. He got hit with a delayed enrollment penalty of 1% per month of that average. So 1% doesn't sound like much, that's 33 cents. But if you take it back all the way to when the first drug plans became available to when he signed up, that penalty added up to about a $50 a month penalty on top of his prescription drug premiums for the rest of his life. So don't delay. It was a false savings. Within that first year, he more than ate up all the money he saved by not having a drug plan all those years. So just as there was with the Part B premium, the high earners also get hit with the income-related adjustment amount, the IRMA, on your prescription drug coverage. And again, the categories are the same for couples, joint return more than $176,000 of modified adjusted gross income. Get a hit with $12 on top of your drug premium, all the way up to $77.10 on top of your drug premium. And that applies whether you're in a traditional Part D plan or whether you're getting your drugs through a Medicare Advantage plan. And likewise, the other side of that is there is extra help for people with low incomes in dealing with these prescription drug costs. And again, if you think that it might apply to you or someone that you care for, make an appointment to talk to one of our HICAP counselors, because we can help you figure out the resources that would be available to you to help you with those prescription drug plan costs. So, excuse me. Medicare has a website called Medicare.gov, and I'm sure many of you are familiar with it. But it's very useful in helping to find yourself a lower cost or better drug plan. And the way you do it is on the Medicare.gov website, and this screenshot is in your handouts. You see right here on the left-hand side of the screen where it says Find 2021 Health and Drug Plans. And you click into that, and it's going to take you to a page that asks for your zip code and then gives you an opportunity to asks you to enter the various prescription medications that you have. And then it will sort those, it will calculate from the database of all of these different premiums, and deductibles and copays to help you figure out which is the plan that will cost you the least in total costs over the coming next year. Just yesterday, I had a counseling appointment with a man who had ignored this thing for several years, and friends would keep telling him, hey, do this, you can find a cheaper plan. So finally he listened to them, and I talked to him. He had gotten a notice that his prescription drug plan for next year was going to boost their monthly premium to over $90 a month. And he had been paying copays on each of his 3 generic medications of $15 to $20 copay each time he picked it up. So I helped him go through this plan. We entered his 3 generic medications, and I found him a drug plan that took the premium instead of $90+ a month to $13.50 a month, and would give him copays of, instead of $15 and $20, of $3. So just by doing this in the space of about 20 minutes yesterday, we found him a drug plan that's going to save him more than $1,000 a year on his prescription drug costs. You can do the same. This is easy to use. They've improved this plan finder quite a bit from the way it was last year and the prior years. Or if you're not comfortable with computers or don't have computer access, make an appointment to talk to one of our HICAP counselors, because we can help you do this. We can do this for you or show you how to do it for yourself. So now let's shift over to Medicare Advantage plans. That's the managed care Part C, where you're required to get all of your coverage, all of your treatment through their network. Now, the Medicare Advantage plans are required to provide the exact same services that you would get under Medicare, under traditional Medicare, although some of them throw in some extra benefits as kind of marketing tools to get more people to enroll. And there are some changes for those plans in 2021. For example, people who have end-stage renal disease, kidney failure, can now enroll in a Medicare Advantage plans that can tailor to them a little bit. Those plans can now offer hospice benefits. But they also are being allowed to use step therapy for drugs. And what step therapy is, sometimes a new drug comes out, and a person with a serious chronic condition, the doctor might want to try the new drug. But drug insurance plans and Medicare Advantage plans are now allowed to say, okay, first of all, you got to take some steps. First, you got to make sure, show us that you tried the older, cheaper drug and it's not effective. And your doctor has to show that before he can get permission to step you up to the newer, more expensive drug. And sometimes it's multiple steps depending on the drugs that are currently in the market before a person gets the okay to go to the newest, most expensive medication. Now, they also have been allowed to add benefits. Remember, I mentioned earlier that they get a fixed amount per month from the federal government. They also get an additional sweetener, an administrative fee, and a little bit of something to help them to recruit and enroll more patients. And that's one of the things that pays for all of these ads that you see this time of year of trying to get you to call up to get one of the commercials, get all of the benefits that you're entitled to try to get people to call and talk to insurance agents and enroll in their plan. But they are able to add some benefits. For example, some of them have added adult day services. Some of them have added over-the-counter medications that Medicare doesn't cover. One of the things some of the plans have done is added non-emergency transportation. So if you have difficulty getting to your doctor's office, you don't drive, or you don't have someone who can drive you, well, some of these plans will pay for you to take a ride-hailing service to and from your doctor's appointment a certain number of times of the year. So they do these kinds of things to provide extra benefits, like gym memberships. Some of them provide some allowances toward acupuncture or dental exams or hearing aids or eyeglasses that Medicare does not traditionally cover. That's why this annual enrollment period is so important, because if you want to change plans, now's the time to do it. So for example, I counseled a woman last week. She got a notice. Her plan said that her doctors are part of a medical group that no longer will be contracting with her Medicare Advantage plan. And if she wants to stay with that plan, she's going to have to change doctors. Well, in her case, she likes her doctors, plural, wants to stay with them. So I helped her find a Medicare Advantage plan that is contracting with her physician's group. And so this is something to think about. And we have the breakdown of all of those plans in one of the handouts that you were emailed. But there are 55 plans. There are many, many pages of this handout. And if you're finding this a little bit too challenging, call and make an appointment to talk to one of our HICAP counselors, and we can talk you through that and help you figure it out. And again, we don't sell insurance. You're going to make your own decisions. Our role is to provide you with objective, non-biased information to help you figure out what's the best decision for you to make. Now, some people use this as a time to switch from Medicare Advantage back to traditional Medicare, but there's a problem here. Under certain circumstances, you might not be able to get a Medigap or Medicare supplement plan, and you have to be sure that you can. Fortunately, here in California, we have something called a guaranteed issue right. And what that says is that under certain circumstances, if your Medigap plan makes certain kinds of changes, like increasing their premium or dropping one of your providers or eliminating or reducing a benefit, it can give you the right to go back to traditional Medicare and be guaranteed that someone will sell you a Medigap plan without asking about pre-existing conditions, for example. There are certain circumstances, and again, we detail this in the handout. And sometimes people have a little bit of trouble with this with the Medigap companies when they want to do that. And so we coach them through in the handouts of how to cite the California insurance code right that you have under the guaranteed issue. And one of the handouts has a listing of all of the plans here that have made the kinds of changes that would trigger a guaranteed issue right. And I think this year for 2021, I think all but maybe 3 or so are making a change that would trigger something like that. Again, though, if you're going to do it, it has to be done by December 7 and takes effect January 1. So there are some other updates that Medicare has added, such as pain management involving non-opioids and a senior savings model that relates to certain types of insulin, encouraging more use of telehealth, which is kind of, the medical equipment, what we're doing, talking to your doctor by video or by telephone. And some of them are then saying, okay, they won't charge for that because they want to encourage more use of that kind of technology and reduce the cost of in-person visits. And you can find out more about that on the Medicare.gov website. And the Medicare.gov website is actually an excellent resource for finding out about Medicare, the Medicare rules, finding the different plans. There are also other CMS, Center for Medicare and Medicaid Services, which is what administers Medicare. And then some of the others that you see on the screen in your handout are really more for people who have problems with the system and need help with certain kinds of appeals about decisions that have been made. Now, I can't finish this up without talking at least a little bit about fraud and abuse. And that's because among my volunteer activities in the past, was volunteering with an organization that worked to prevent Medicare fraud and abuse. And I will tell you, the last numbers I saw, Medicare, it's estimated, loses about $50 billion with a B, dollars a year to fraud, waste, and abuse. And most of the fraud is triggered to scammers getting a hold of your Medicare number. And they can do a lot once they have that number. And some of the ways that they get it, they will offer free genetic testing just for your Medicare card. Well, Medicare doesn't cover routine genetic testing. They just want your Medicare number. They promise $200 Medicare cards, Medicare drug bonus cards. Well, those don't exist. Other kinds of scams, COVID testing. But here's what happens. There's still the commercials on TV for a free back brace or a free knee brace or a free cane, all free through Medicare. here's what happens. What they're really doing is collecting your personal information. They may send you a free cheap back brace, but now they have your name, your address, your telephone number, your Medicare number, maybe your drug plan number. And among other things, they submit fraudulent claims to Medicare, claiming to have provided services to you that they never provided, and they inflate the bills for those, and Medicare pays it. One example, a woman I counseled, and these are all true things. When I say I counseled these people, these are actual people I talked to. A woman who looked at her Medicare statement, and there was a charge for about $20,000 for a procedure on her leg. Well, she told me she had never met with this doctor, and she had never had such a procedure. But Medicare paid this fraudulent bill. And when I tried to contact the doctor's office as part of the research to see was this a mistaken bill, all I ever got was an answering service that said repeatedly, sorry, doctor's not in, sorry, doctor's not available. And so we ended up turning this over to law enforcement, and they went after this guy. But cumulatively, these things have a $50 billion impact on the Medicare budget. And then what these scammers also do is they sell your personal information to other scammers. And now you're a target. So please, someone offers you something, says it's free through Medicare. Don't do it. It's probably a scam. And Medicare will never call you and ask you for your Medicare number. Don't ever do it. Just hang up. But if you think you might have been scammed, might have been a victim of that, call HICAP. We have one of our HICAP volunteers who specializes in Medicare fraud that can help you kind of sort through this. And that's a number again for the appointments. And maybe one day we'll be able to start meeting with people in person again. But for now, appointments and video calls. And with that, I will say thank you and turn it over to open up to questions, Stephen.